Ministry of Health of Ukraine. Krok 2. Medicine. Year 2020. Number 007. A 20-year-old patient complains of a severe headache, double vision, weakness, fever, irritability. Objectively, body temperature is 38.1 degrees C. The patient is reluctant to contact, sensitive to stimuli. There are ptosis of the left eyelid, exotropia, anisocoria S greater than D, and pronounced meningeal syndrome. On lumbar puncture, the cerebrospinal fluid flowed out under a pressure of 300 mm Hg. The fluid is clear, slightly opalescent. 24 hours later there appeared a fibrin film. Protein 1.4 grams L. Lymphocytes 600 per cubic millimeter. Glucose 0.3 mmol L. What is the provisional diagnosis? A. Syphilitic meningitis. B. Lymphocytic, Armstrong's, meningitis. C. Meningococcal, meningitis. D. Tuberculous meningitis. E. Mumps meningitis. A lumbar puncture involves collecting a sample of the cerebrospinal fluid, CSF, to find out what is causing the meningitis by identifying a specific virus or bacteria. Comparison of bacterial meningitis to viral meningitis. White blood cells, much higher, a different type of white cell. Normal range, up to 5 per cubic millimeter in adults and 20 per cubic millimeter in newborns. Protein, much higher. Normal range, 0.23 to 0.38 grams L in adults. Glucose, much lower. Normal range, 2.5 to 4.4 mmol L, 2/3 of blood glucose. Causative agents: tuberculous meningitis, Mycobacterium tuberculosis, meningococcal meningitis, Neisseria meningitidis, meningococcus, lymphocytic, Armstrong's, meningitis, lymphocytic, choriomeningitis, mammarinovirus, family Arenaviridae, syphilitic meningitis, Treponema pallidum, Mumps meningitis, paramyxovirus, rubella family. The patient has symptoms of meningeal syndrome, headache, fever, and a stiff neck, with focal neurological deficits. It may cause ptosis of the left eyelid, exotropia, and anisocoria, and has much higher in white blood cell, lymphocyte, much higher in protein, and much lower glucose concentration in CSF. In tuberculous meningitis, fever and headache are the main symptoms. Confusion is a late feature, and coma bears a poor prognosis. Patients may also have focal neurological deficits. Acid-fast bacilli are sometimes seen on a CSF smear, but more commonly, M. tuberculosis is grown in culture. Meningococcal disease can appear as meningococcal meningitis, meningococcal septicemia, or a combination of both. Meningococcemia, like many other gram-negative blood infections, can cause disseminated intravascular coagulation, DIC, which is the inappropriate clotting of blood within the vessels. DIC can cause ischemic tissue damage when upstream thrombi obstruct blood flow and hemorrhage because clotting factors are exhausted. Small bleeds into the skin cause the characteristic petechial rash, which appears with a star-like shape, due to the release of toxins into the blood that break down the walls of blood vessels. The answer is D. Tuberculous meningitis.